Wisconsin Breast Cancer Coalition is asking Wisconsinites to help pass Gail's law in the Wisconsin state legislature. It will require health insurance and Medicaid to fully cover diagnostic breast exams like MRI and ultrasound for an abnormal findings, and supplemental screening exams for those at high risk of breast cancer or with a mammogram finding of dense breasts. It passed in the state Senate, and the Assembly Health Committee just voted unanimously for it. Next, the Assembly Speaker must bring it to the entire Assembly for a vote. Please tell your state representative to support this life-saving bill by going to earlydetectionwi.com. Your voice can make a difference.
Hi, I'm Kurt Edel. I'm a medical oncologist at Gunderson Health in La Crosse, and I'm here to speak on behalf of Gail's Law as well as Cole's Law. The two legislative issues that are facing our assembly right now are actually patient impactful and issues that affect every patient in the state of Wisconsin. And these are issues that we really need to move through the assembly. So I'm asking anybody who's listening to this to really get out the vote, contact your legislator, understand that of all the things that come up in front of our legislation, this is really one of the most important and most impactful for the people who really need it. Thank you.
Hi, I'm Adrienne Calvin. I'm a breast surgical oncologist, and we need to pass Gail's Law. Our patients deserve to get the high-risk screening that allows the early detection of breast cancer to limit the burden of cancer treatment and overall impact on their lives.
Hi, I'm Carrie Cataldo.
Hi, I'm Helen Lambrin.
So Helen, can you tell me a little bit about Gail?
I can. At the age of 47, Gail Zemer was diagnosed with stage 3 breast cancer. Her regular mammogram 1 week earlier was clear for evidence of breast cancer, but they noticed an enlarged lymph node. That led to an ultrasound, and that led to the discovery of a hidden 4-centimeter tumor. Gail learned that the tumor was not visible on her mammogram due to her dense breast tissue. She channeled her shock into learning that dense breasts could mask her tumor, and women with dense breasts have 4 to 6 times higher risk for developing breast cancer.
So how could her tumor have been diagnosed earlier?
The problem is that a tumor shows up white on a mammogram, but dense breast tissue is also white on a mammogram. It's like trying to see a snowball in a snowstorm. MRI and ultrasound work better for dense breasts. Unfortunately, the additional out-of-pocket costs for those tests is often the reason women put them off, leading to a later diagnosis of cancer. Sadly, we lost Gail to metastatic breast cancer in June 2024. Her family and members of the Early Detection Saves Lives Coalition, including the Wisconsin Breast Cancer Coalition, continue the fight for cost-free supplemental screenings in her honor and in her memory. Please join us by going to earlydetectionwi.com.
Hi, my name is Alicia Rooks. I am a 2-time breast cancer survivor. Gail's Law will ensure cost-free supplemental screening for Wisconsin women with dense breasts or who are otherwise at high risk for breast cancer. It's very important that early detection is done. Thank you.
So I've heard about Gail's Law on social media. What is it?
So Gail's Law is a bill that's moving through the Wisconsin state legislature, requiring health insurance and Medicaid to fully cover diagnostic breast exams for an abnormal finding, and also supplemental breast exams for screening like MRI or ultrasound for those that are at high risk of breast cancer or with a mammogram finding of dense breasts.
So these tests would be free to patients?
That's right. Insurance may not charge for these tests.
Where is the bill currently in the legislature?
So it did pass in the state Senate, and the Assembly Health Committee just voted unanimously for it. Now the Assembly Speaker must bring it to the entire Assembly for a vote. Then Governor Evers will sign it.
It's so close. Oh my gosh. What else can I do to help?
please go to earlydetectionwi.com. Your voice can make a difference.
All right. Thank you.
My name is Keisha Jones, and I am a current metastatic breast cancer thriver and patient advocate. Imagine if you just had your first mammogram at the age of 40, and the results showed no signs of cancer, but your breasts are extremely dense. On top of that, your mother had breast cancer in her 40s, so your primary care physician recommends a screening MRI. You have insurance, but you get a message that you'll have to pay $750 out of pocket to get the MRI. You're living paycheck to paycheck. Your daughter just got braces with the first bill for $500 due next week. And your son needs new shoes for basketball. Which do you choose? Pay the orthodontist or get a screening MRI? That's a choice no mother in Wisconsin should be expected to make. By the time a mass is seen on a mammogram with dense breast, it could be very large and could have spread to the lymph nodes or other organs. When treatment is much more difficult and the prognosis could be terminal. This is why Gail's Law is so important. It would allow patients in Wisconsin to get cost-free screenings, MRIs, and ultrasounds, diagnosing cancers early when most treatable. How can you help? Please go to earlydetection.com to make a difference today. Thank you.